Democrats request information on drug pricing policy. A Senate committee advances multiple health-related bills. And the Congressional Budget Office calls for more research on the No Surprises Act. For the week of June 22nd, 2026. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
We should be focused on how do we make their life better. We have 8 bipartisan bills before us today. These will make their life better. Bills that help Americans get a life-saving organ transplant.
Kicking off this week's episode with news from Capitol Hill, where the Senate Health, Education, Labor and Pensions, or HELP Committee advanced 7 health care bills during a markup last Wednesday. The legislation approved by the panel included the Charlotte Woodward Organ Transplant Discrimination Protection Act, the Healthy Start Reauthorization Act, the Stem Cell Therapeutic and Research Reauthorization Act, the Early Act Reauthorization, the Accelerating Access to Critical Therapies for ALS Act, the Medication Affordability and Patent Integrity Act, and the Biosimilar Red Tape Elimination Act. During the markup, committee members also debated the Ensuring Timely Access to Generics Act, ultimately punting on voting on the bill. The legislation aims to increase access to generic pharmaceuticals by preventing brand manufacturers from using citizen petitions to delay competition. The vote on the bill was postponed following Ranking Member Bernie Sanders, an independent from Vermont who caucuses with Senate Democrats, attempt to offer amendments to the bill, some of which Chairman Bill Cassidy, a Republican physician from Louisiana, characterized as poison pills and, quote, more about messaging, unquote. Republican leadership of the House Energy and Commerce Committee have sent a letter to the National Institutes of Health regarding 2 NIH researchers who allegedly transported biological materials into the U.S. illegally. The correspondence concerns the case of laboratory scientists Vincent Munster and Claude Q, who have been charged by the Justice Department with conspiring to smuggle Mpox and other biological material into the country in an incident that took place on January 25th at Detroit Metropolitan Airport. The researchers were returning to the country from the Republic of Congo. Munster and Q have pled not guilty. The committee leaders asked NIH Director Jay Bhattacharya to provide information about, quote, the circumstances surrounding the alleged importation of biological materials, the research activities involving those materials, the adequacy of NIH biosafety oversight, and any corrective actions the agency has taken or plans to take, unquote. A response to the letter is requested no later than June 30th.
Democrats now, and I want to drive this point home as we begin to go to my colleagues, we will work with anybody who wants to work constructively to lower drug prices. Unfortunately,
that was the voice of Senate Finance Committee Ranking Member Ron Wyden, a Democrat from Oregon, who's requesting information about potential drug pricing policy proposals, focusing specifically on lowering the price manufacturers charge for prescription drugs, lowering out-of-pocket costs for patients, and fostering biopharmaceutical innovation in areas of unmet need. He's also focused on bolstering domestic clinical trials and recruiting and maintaining scientific talent. The policies outlined in the 42-page document could inform the Democratic agenda should the party regain control of one or both chambers of Congress next year. Comments on the request for information should be submitted to drugs@finance.senate.gov. That's drugs@finance.senate.gov. No later than August 17th. The Congressional Budget Office, or CBO, published a blog post last week calling for further research about the effectiveness of the No Surprises Act. CBO notes that the NSA has protected patients from surprise bills, but that emerging evidence suggests the law, quote, might not have the effects that CBO anticipated, unquote. while prices for some services that had high rates of surprise billing before the law's enactment have declined. CBO cites reports which, quote, indicate providers are winning more than 8 in 10 independent dispute resolution cases and are being awarded payments that are much higher than expected, particularly in certain geographic areas, unquote. The agency calls for new research that evaluates the law's effects on healthcare prices and network participation. Comments can be submitted to communications@cbo.gov. That's communications@cbo.gov. The Medicare Payment Advisory Commission, or MedPAC, has released its June report to Congress. The 6 chapters of the report cover the following topics: improving payment incentives in Medicare, the complexity of Medicare enrollment decisions for beneficiaries, Medicare payment operations and their role in identifying improper payments, estimated association between Medicare Advantage enrollment and hospitals and post-acute care providers' finances, access to hospice and certain complex palliative services for beneficiaries with end-stage renal disease or cancer, and an assessment of the Medicare ground ambulance data collection system. The full report can be accessed at medpac.gov.
Poughkeepsie, which has so many parts of the portfolio. But I also want to thank you for your leadership over the decades for promoting these alternatives to animal testing, for emphasizing the need for research that really does translate to better human health, because that, of course, is the mission of the NIH.
Final news today, where the National Institutes of Health announced a formation of a new office focused on the development, validation, and scaling of the use of animal testing alternatives. The Office of Research Innovation, Validation, and Application will be located in the Division of Program Coordination, Planning, and Strategic Initiatives. NIH Director Jay Bhattacharya said, quote, complex computational models, 3D human tissue models, and other emerging technologies have improved by leaps and bounds in recent years and may hold the key to a more effective research enterprise. He went on to say, quote, by strategically capitalizing on these tools and encouraging further innovation, NIH aims to steer biomedical research in this direction, unquote.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Help Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Wednesday, June 24th at 10 a.m., the Senate Indian Affairs Committee holds a nomination hearing to consider Mark Cruz to be Director of the Indian Health Service. Second, on Wednesday, June 24th at 2 p.m., the Joint Economic Committee hosts a hearing titled Protecting Patients and Taxpayers, Combating Healthcare Fraud and Leakage to Strengthen Program Integrity. Third, on Thursday, June 25th at 10 a.m., the Senate Appropriations Committee convenes a markup of their Agriculture Rural Development FTA Bill, Military Construction Veterans Affairs and Related Agencies Bill, Commerce Justice Science Bill, and Legislative Branch Bill. Fourth, on Thursday, June 25th at 10:15 a.m., the House Energy and Commerce Subcommittee on Oversight and Investigations gavels in the hearing State Medicaid Program Integrity, Examining Fraud Risks and Oversight Deficiencies. And last, on Thursday, June 25th at 2 p.m., the House Ways and Means Subcommittee on Work and Welfare holds a hearing titled Maternal, Infant, and Early Childhood Home Visiting Program. Early Support, Lifelong Impact. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.